Welcome to Pediatric Grand Rounds. We have the special guest from our colleagues in the Department of Psychiatry, and Dr. Michael Cheng. So we always start with our land acknowledgement. And Ottawa is built on the unceded Algonquin and Anishinaabe territory. The peoples of the Algonquin and Anishinaabe Nation have lived on this territory for millennia and honor them on this land. Their culture and presence have nurtured and continue to nurture this land. CHEO also honors all First Nations, Inuit, and Métis people and their valuable past, present, and future contributions to this land. As I mentioned, our presenter today is Michael Cheng. Michael and I have known each other a long time. It's great to see him presenting here today. He's an associate professor in the Department of Psychiatry at the University of Ottawa and a psychiatrist at the Children's Hospital of Eastern Ontario, where he helps families cope with modern society by helping them, brackets, reattach to nature, people, and other things that give purpose and meaning. I liked your bio, Michael, so I'm going to read it verbatim. He is the co-founder of ementalhealth.ca, which provides information to families and professionals about mental health and resources. As a parent, he knows firsthand the challenge of staying connected to nature and fellow humans in an increasingly virtual world, and now the added challenge that pandemic parenting has brought us. Dr. Cheng is a busy parent of two who is happy to discuss carpooling and activity options for his 10 and 12-year-olds. I wanted to make sure I got to that last bit too, Michael. So with that, I'll hand it over to you.
Thanks very much, Pranish, and thank you everyone for having me here today. It's nice to bump into you guys in the hallways, and it's nice to see you in this context as well. I'm going to share my screen, and can you guys see my slides? Actually, you know what? Before I start the presentation, I wanted to just introduce my medical student with me. Pierre Marc, are you there? Can I just put you on the spot there and have you turn on the camera and say a few words if you're decent? Oh, wonderful. Perfect. So Pierre Marc Dion is an Ottawan, and he is my medical student this week. And I wanted to do a shout out, however, because Pierre Marc is actually Captain Pierre Marc in the Canadian Forces. And so I wanted to just highlight that there are so many wonderful options for people interested in healthcare, and that includes being a medical officer with our armed forces. And unlike many students who complain about finances and worries about this and that, and I have to pay for their coffee, yesterday, actually, Pierre Marc offered to buy my coffee because he's actually paid to do his training and residency. So a shout out to Pierre Marc. Thank you for everything you're doing so that I can do what I can do.
Thank you.
Okay, now I will continue to share my slides and do the presentation. Okay, so we're going to talk about how to help children, youth, and families with self-regulation in our modern dysregulating world. And I have the usual disclosures, and I have not a land acknowledgement slide. It's a visit the First Nations Child and Family Caring Society, and that is one way we can help advocate for equity and justice. Okay, so we're going to talk for, I'm going to talk for hopefully not too long, and then hopefully we'll have time for questions at 9:15, and then we'll wrap up, and then you can go to the bathroom and rush off to your next meeting. By the end of this session, you will be able to explain self-regulation to a family, perhaps a family you're seeing, or maybe even your own family. You'll be able to create a self-regulation map. And I know some of you don't really care about all that stuff. You just want to know where to refer to. So yes, we'll talk about that too. So I want to share something with you that really changed my clinical practice. It's learning about concepts of self-regulation. So I've been at CHEO for over 20 years, and I've learned about many treatments and interventions. And in the very beginning, I was very keen, you know, there'd be a workshop about cognitive behavioral therapy or a workshop about mindfulness or sensory processing and whatever it was. I was so keen, I thought I would learn this therapy or tool, and I'd hope that'd be the last tool I'd have to buy. But after 20 years, I realized there probably is never going to be one single tool that I can just use. There's no sonic screwdriver like Doctor Who. Good news, I've found a toolbox which helps us understand all the therapies we learn about and interventions and coping strategies, whether it's deep breathing or mindfulness or exercising. It's actually really made a difference in how I think about patients. And because it's all about precision healthcare, it's helped me more precisely decide for which patient at which time, and that can change minute by minute depending on our patients. And that helps me decide which tool, strategy, or intervention to use. So today, we're going to talk about this thing called self-regulation, and it's not so much a new therapy per se, but think of it more like another lens to view things, and it works with whatever other treatments you do, whether you're a mental health care worker or actually if you're a pediatrician and you're doing primarily physical or biologic therapies. So let's start with a typical case. A typical case that we get asked about is, oh, my daughter has depression, can you help her? Or my child has anxiety, they refuse to go to school, they have temper tantrums, they can't focus, they're bored all the time. And I used to look at these as different things, but it turns out there's really a common theme in all of the above. And as you can guess, the topic of today is self-regulation. So in a sense, they're actually all issues where people have troubles with self-regulation. They have troubles getting back to that calm state, that green state. That calm green state that Pranish seemed to be in, sipping his coffee with the nice background and his calm environment. So as a pediatrician or in your work with children and youth, you might be seeing these kids as part of your work, or maybe not. But even if you don't see these kids, you're going to get asked about these kids because someone is going to say, well, I can't find a family doc, and I understand you work at CHEO or with children and youth. Can I tell you about my kid? So you're going to get asked about these kids. And so I know what many of you will do. You'll say, well, I recommend you call one click. And so absolutely, you're going to refer them. Unfortunately, wait lists are long, and these people are going to still come back and see you. What are you going to do in the meanwhile? Solution, we're going to talk about self-regulation and ways you can incorporate that in your practice and maybe even personal life. So for those of you out there who are familiar with self-regulation programs, I will give credit to the first wave of self-regulation programs like the ALERT program, How Does Your Engine Run, Zones of Regulation. Those of you who have kids in schools will probably recognize some of these concepts because many schools in Ottawa use the zones of regulation. So we're going to be using that and building on it. Today, I'm going to present an integration, so to speak. We're going to be integrating the later, newer knowledge of polyvagal theory from Stephen Porges, Deb Dana, as well as the newer work of Bruce Perry. So we're going to see if we can all make them play well together. And if there's any people from the CHEO, Innovation Hub, if you guys are here, I would love to talk to you, see if we can give this a fancy name so we can support CHEO, like maybe the CHEO self-regulation model. Who knows? Okay, so let's start with an introduction to self-regulation. We're going to use most of the time, we're going to use the word zones because that's what most people are familiar with. But it could be, you could call it a state of regulation as well. And so the idea is that thanks to 6 million years plus of evolution and development, our brain has different states of regulation, just like a car has different gears. And yeah, when Pranish and I were training, you could still get manual transmission cars, right, Pranish? Maybe you even drove one. And it's sort of sad. Our kids nowadays will never know the joy of learning a gear shift. You just press a button and the computer does it all automatically. So, so our brains also have different modes. And a quick review, and then we'll go over these in more detail, is we can be bored and understimulated. we can be in the green zone, which is just right, our happy place, ventral vagal if you're a polyvagal theorist. However, life is stressful, so you can get triggered into yellow zone. And if stresses are really big, you get into red zone, and it actually activates our fight, flight, and freeze. And if stresses go on for too long, we go into shutdown, and that's dorsal vagal from the polyvagal theory. From the moment we wake up to the moment we fall asleep, we are all going through different states of regulation. And because you guys are here, because of just the nature of the work you do and being at CHEO and being in healthcare, most of you are probably awesome with self-regulation. And so you don't think about it. It's just something you do automatically. And so part of what I'm going to be doing today, you're going to say, I do this automatically, don't even need to think about it. But it's good to be able to deliberately think about it, because then we can realize that it doesn't come automatically for everyone, especially the kids that we see. And by breaking it down into smaller chunks and then explaining it, it gives us another tool to help. So when we wake up, we might be understimulated in the board zone. And then we automatically do things to self-regulate, like a shower, having our coffee. And then during the day, hopefully you're in the green zone, whether you're doing awesome work on the computer, whether you're having a meeting, having clinical care, doing teaching, or going back to the cafeteria to have more coffee. So hopefully all those things keep us in the green. And little shout out to CHEO. It helps if you have a good work environment. So I realize that I'll do a shout out for CHEO as well. CHEO is actually #1 for healthcare in terms of Canada's best employers. We only got beat out apparently by Hershey's, and they're not in healthcare. So for healthcare, we're #1. So thank you for all my managers and leaders that make that possible. However, life is stressful. So on our day, on the commute, maybe your kids miss the school bus, so you have to drive them. That's a stress. The traffic's horrible. Public transit is late again. Thank goodness. And that actually is what happened to me. I was hoping maybe to go in and just do this rounds in person, but then something came up with the kids. And so thank goodness with the pandemic, we can do this virtually. So that helped me get back into a green zone. And then at work, something happens. Our work is not easy. Maybe someone gets upset at us. Something goes wrong. Patient outcome doesn't go as we hope. We have some loss, disappointment, or failure. On the other hand, sometimes things get boring. We have periods in our day where we're not stimulated enough. So that's like me trying to do my charting at the end of the day and falling asleep. And then I realize I've spent the last 15, 30 minutes just redoing the same thing on that progress note. And so being too understimulated can be an issue too. And then if stresses are too big, then it can actually activate fight, flight, or freeze. So when we get those code blue calls, and if you're on that team, then, well, actually, I shouldn't say that. If you're on that team, I know you guys like doing that stuff, so that gets you into the green zone. But me as a psychiatrist, I hear that and I get a bit stressed out, and I say, thank goodness for you guys and my colleagues who are able to take care of that. But we can imagine someone is in a fight, flight, or freeze when we have those crises happen. Now, if things go on for a long time where our system is overwhelmed, and if our body has not been able to cope by going into the yellow zone, and if going into fight, flight, and freeze hasn't worked, then our body actually will cope by conserving energy and shut down, and that's dissociation. And so it can present itself as symptoms of dissociation, like people with actual trauma disorders, but it also is what we call burnout, and going to work but being numb and just not caring and just wanting to get through so you can collect the hoop. Now, in our work, when we ask parents, what do you want? They often say, we just want our child to be happy. So in a sense, they really just want their children to be self-regulated and in the green zone. So it all does come down to self-regulation. So let's do a bit more detailed definitions. So self-regulation overall is the ability to manage ourselves in response to all the demands and challenges that happen. And it includes many concepts. There's physiologic regulation. So it's the ability to regulate temperature and digestion and heart rate and blood pressure and those things. And some of our kids struggle with this. So if you have if you have autonomic dysautonomia, if you have postural orthostatic tachycardia syndrome, then you have troubles regulating this. And then that's going to make it harder to regulate all the other things. Hopefully, though, you can regulate these things. And if so, then hopefully you can regulate, you know what, I didn't put sensory motor, but that's important. You have to be able to regulate your sensory input and your motor functions. You also have to be able to regulate, actually, this is awesome. I have Pierre Marc. So Pierre Marc, can you just make a note so that I put that in my slide? Thank you very much. I have to say, when you work with medical students, if you work with a student who's in the military, they are the best. Anyways, thank you, Pierre Marc. So emotional regulation is another step, and that's the ability to regulate our emotions so that most of the time, even if you get stressed, we can get back to a green. And there's cognitive regulation, so the ability to regulate our thoughts, our executive functions, and be able to manage that part. And there's things that we can do that affect your cognitive load or cognitive regulation. So, naturally in our work, we're all dying of email overload and cognitive overload. And so it is a struggle for all of us to keep cognitively regulated. And then there's behavioral regulation. So that's the ability to regulate our behaviors so that most of the time we are doing healthy behaviors to cope and have less negative behaviors. My own personal negative behavior is, this morning as I was touching up the slides, I was thinking, why did I spend an hour surfing through news last night? And now I'm stressed out this morning. But that's another issue. So the point of this slide here is that many issues that we see on the surface, whether it's mental health issues like anxiety, depression, or eating disorders, or psychosis, addictions, we realize now they're actually underlying issues with self-regulation. So, for example, Aziz did a really nice study where restriction of food was demonstrated as a coping strategy to regulate emotion. So I know most of us probably think this intuitively, but of course, thank you for our researchers out there for actually giving us the evidence for it. So we're seeing a child for self-regulation, or neighbors asking us about a child with self-regulation issues, or maybe it's our own child or relative. So what do we need for self-regulation? So let's do a quick bioevolutionary theory review. So on the existence of humans, most of our time on this planet as a species has actually been hunting gathering. That's over 97% of our existence. And so most of our base wiring is based on living in this way. And yes, 6,000 years ago, we developed farming and started civilizations. And yes, screens are everywhere, but that's less than 20 years ago. And that's less than 0.01% of our existence as Homo sapiens, based on, onset of Homo sapiens being 200,000 years ago. So the way we live for most of our history as hunter-gatherers helps us understand, oh, my mouse is very sensitive. I'm going to stop moving my mouse around. Sorry. Okay, so the way we lived as hunter-gatherers helps us understand why we are wired to need face-to-face connections, why we're wired to need nature and movement, why healthy nutrition of non-processed foods is important for us, helps us understand why we need shelter and housing and things to keep safe. And so if those basic needs are met, then hopefully we have higher needs, such as a sense of belonging, purpose, meaning, and hope. And just a few brief things about belonging, purpose, meaning, and hope. So belonging is feeling connected to something, feeling connected to our family, our community, our culture, the land. Purpose is what we do every day. It's what's in our Outlook schedule. It's what keeps us busy. So humans need to be busy. And we're very lucky. We're in healthcare, and that keeps us busy. Sometimes too busy. We also need a sense of meaning. Meaning is that what we do is actually meaningful. And so what is nice about our work is that working with children, youth, and families, it is purpose, but it's also very meaningful. We get to help other people. We get to make a difference. And some people don't automatically have that in their work. You know, all of us have friends in the federal government who complain about their work, and maybe you're doing some boring job that doesn't stimulate you. In that case, you'll have to get your meaning from doing other things. And hope. Hope is essential as well. We need to know that things will get better in the future. Oh, yeah, I gave this talk to a group of family docs, so it still says primary care crisis. I'm going to ask Pierre-Marc. Pierre-Marc, can you remind me to update this one? And speaking of Pierre-Marc, my medical student, for those who came in late, his hope is that he will finish his week with me, move on with his life, finish his medical school, then residency, and then I'm sure that is one of the things that gives you hope. So if we can have our basic needs met, if we can have our higher needs met, then that is more likely to fill our bucket with positive factors and resiliency factors, and then that helps us to get to the green zone. The problem, however, in modern society is that things distract us from that which we truly need. And so all of us who have kids find most likely that it's hard to get the kids off the screens and hard to get them off the sugar. And as a society, we are facing an opioid crisis. So it's hard to get people off the substances. And this is mediated by dopamine and adrenaline. In addition to that, add-on stress. We have all the stresses from society right now, housing crisis, intergenerational inequity, all sorts of injustices, the negativity from the mass media, social media, and internet that kids are exposed to all the time. This is particularly relevant in my work doing eating disorders, and so on. And so with all these stresses, we are seeing an epidemic of children, youth, and families who have more negatives in their bucket than positives. That's leading them to become dysregulated, go into a yellow zone and red zone, and maybe even beyond red into shutdown. And that is inundating our mental health services right now and our health services. So let's move on and go into just a bit more detail about each of these zones. So what's the bored zone? First of all, the bored zone is the fact that in order to be alert, your brain needs just enough stimulation to make just enough adrenaline and dopamine. Otherwise, you're going to be understimulated. And note that as hunter-gatherers, we developed under conditions where we were physically active 7 to 15 kilometers a day, outside all day and together with other humans. So we can first and foremost understand why perhaps this largely sedentary lifestyle we live now, being indoors all day and being disconnected from other humans on our screens, might be one of the factors that contributes to our issues. And so if you have troubles with boredom, the good news is there's things we can do about it. So the usual thing we recommend if kids are in the bored zone is make sure we challenge them enough. And it could be physical challenges, it could be academic challenges, and hopefully that helps. Another strategy that we can do if kids are struggling with the bored zone is we can help them cultivate an appreciation of low dopamine and adrenaline, such as doing mindfulness activities. In other words, things where we're not being distracted. So folding clothes, sweeping the garage floor, mindful eating. Sorry, my mouse is too sensitive. And I was going to make, yes, here's my joke. When I was a kid, we went to church. And going to church was a wonderful mindful activity, having to sit for an hour or so at a time and tolerate that low dopamine. And then every once in a while, we'd have Mass in Latin. So that also definitely helped us appreciate low dopamine. And one of our big struggles as parents these days is helping our kids keep themselves occupied without just turning to a screen. And that's just a very quick summary of the board zone. So now let's talk about the green zone. So many terms can be used to describe the green zone. Philosophers and writers have been working on this one for millennia. And when you're in the green zone, you're happy, content, calm, safe, relaxed, pleased, gleeful, jubilant, satisfied. And this is one of the things I love about the green zone concept. We can just call it green zone. And that's less cognitive load for kids trying to understand their feelings. Now, if we've been trained in dialectical behavioral therapy or DBT, this is also called the rational brain. So this is when we can access our cortex, our cortical brain, the most advanced layer in our evolution, and the layer of brain that is why we have language and why we dominate the planet, for better or for worse. When we are accessing this brain in the green zone, we can use language. We can actually talk about our problems, talk about our issues. And so when you're a clinician and you ask the patient, what's going on, how are you feeling? If they're in the green zone, then they can tell you these things more easily. And green zone is where we want to be in order to best function at home, work, school, and life. Self-regulation is essentially doing everything we can to help them regulate or co-regulate so that they can get to and stay in the green zone. And this is just to reinforce that point. And I really like Bruce Perry's model. So in his model, he basically talks about how there's reason, relate, and regulate. So if you're in the green zone, then people can reason. They can be rational. And that's when we can talk about problems and solutions together. And so getting back to that earlier slide where I said parents often say, I just want my child to be happy. In my work, I try and help parents understand that what they want is self-regulation. And then we can actually operationalize self-regulation as a specific skill and strategy. When they say, I just want my child to be happy, well, as we know in the happiness research, you can't chase after happiness. Often that involves hedonism, just wanting to do fun things in life, but that doesn't alone make you happy. It's having a life well lived, and happiness is a nice byproduct. And so when we can help them self-regulate, that naturally gets us there. And I always use bioevolutionary theory to involve my work, to inform my work. So I think about, what was it that hunter-gatherers had for happiness? Just chilling out on the fire, doing things. For a psychiatrist, this is my happy place when I get to talk to people all day and tell them what to do. And if you're a surgeon, actually, I'm going to ask Prash, would there actually be any surgeons here right now, or are they all in the OR right now? Maybe they're, sorry?
Well, I think they're probably in the OR movement.
Okay, so there you go. The rest of us we'll just think of our colleagues. So thank you, surgical colleagues. And actually, my dad was an anesthetist, so he would be best when, intubating someone, because then they can't talk to you. Okay, so that's green zone for a surgeon. And You know what? I did have, I used to have a slide for emergency room doctors, emergency physicians. So green zone would be, doing trauma stuff for an emergency physician. So there you go. Whereas for me, that would put me in my red zone. And so a point here, I'm making a joke about it, but a very important point in life is how we all have a different profile. And so part of understanding and helping the children, youth, and families we work with, or surviving a relationship and a spouse, is understanding what everyone's zones are and profiles are. Okay, let's move on and talk about yellow zone. So yellow zone is when we have a stress, maybe it's a loss, disappointment, and it gets us upset. And then we go into emotional brain. And we might describe it as being sad, upset, stressed, frustrated, many terms to describe this as well. And so once again, I like the simple language. We can just call it yellow zone. And for kids who are struggling with an emotional vocabulary, it is tough for them. If adults are using all these complex different terms all the time, it is easier if we just stick to a common language like yellow zone or emotional brain or whatever works for them. So why do we even have emotions? Well, we have emotions because as a data processing strategy, our physiology determined that labeling things as emotions through the amygdala would help us more efficiently make sense of all these things that are happening. However, when things are overwhelming, our emotions get overwhelmed. And so it's that limbic brain that gets overwhelmed, and then you can't access the logical brain or the cortical brain. And so all of us are probably familiar with some features of the yellow brain. So, oh, this is great. I'm going to pick on anyone who's, you know what? I'm going to pick on my medical student. Are you there, medical student?
Yes.
Perfect. I should actually be more respectful. Can you turn on your screen? Because I'm going to ask you some tough questions, Pierre Marc. So, Pierre Marc, you're a married man, and you've been married for quite some time. And so I will assume we haven't coached this ahead of time, so this could go either way. Let's see. So Pierre Marc, when your wife is upset, especially if she's upset at you, what does she want? Does she want you to tell her what to do and give her some solutions? Or does she want you to give support, like listen, validate, and empathize? Oh, Pierre, I can't hear you. Turn on your mic. Let's tell the audience.
Uh, the right answer is definitely B. Whether that happens or not every time. Yes,
Absolutely right. I appreciate your honesty and in full humanity.
wife and learn as a
Yeah.
husband. So
Okay. Thank you, Pierre Marc. And in a statement of solidarity and complete humanity as well, I do also struggle with this too. When I'm in the red zone myself or in the yellow zone, it is hard to empathize, and sometimes we revert to other patterns. So, okay, thank you, Pierre Marc. When people are in the yellow zone, we want to give empathy as opposed to tell them what to do. This is not easy for us because as adults and healthcare providers, we are actually often operating in the green zone. And so we expect other people to be in the green zone as well. And so that's why often our first go-to when people are upset is tell them what to do. And then of course, they see me and then they tell me that those other therapies and interventions didn't work. And that's what I hear. So if people are upset, give support, not solutions. In other words, if we use the Bruce Perry line, did we use the Bruce Perry line? The Bruce Perry line would be help them, relate to them if they're upset. Okay. And that helps us understand why when people are in the yellow zone, telling them to do deep breathing and telling them to do yoga and mindfulness may not necessarily work. Certainly by the time they get to see me, those things don't work anymore. And certainly when people are upset, don't make too many demands on their brain. Don't argue with someone when they're upset. Don't raise your voice. And don't punish them. Don't threaten them by saying, if you don't do this, then you're going to lose that privilege, etc. Okay, so we're going to just zoom ahead and say, what if people are in the red zone? So if people are in the red zone, that's one of the reasons might be that the system, the person has been overwhelmed, too much stress. And if we're in that zone, that's our primitive reptilian fight or flight freeze brain. And so in this zone, we can't access the logical brain. We can't access the emotional brain either. So we're beyond logic. So telling someone what to do and rationalizing isn't going to help. We're also beyond emotion, emotional brain. So what that means is, it means trying to give empathy and validation may also not work. And there's many terms that describe this: angry, overwhelmed, fight, flight, freeze. And then I love it in society how there's so many terms to describe rage. We are definitely struggling as a society with red zones. We've got road rage. The pandemic brought us mask rage. We've got air rage. We've got blinded by rage. So we are a very angry species. On the other hand, people can also have flight. So nervousness, unease, worry, dread. So once again, for helping kids learn these concepts, and for helping parents who might not have learned these emotional literacy terms when they were growing up themselves, I love the fact that we just call it red zone. And so Bruce Perry tells us that if you're in the red zone, that's when we have to help people regulate. So we don't get upset at a child because they're in a tantrum. With empathy, we say, wow, your brain is overwhelmed. It is up to us, calm humans around, to try and help you regulate. So in DBT, we talk about ride out the wave, weather out the storm. And this is a great analogy, by the way, because when we ask parents and the kids, what happens after a storm? They say, it's always nice after a storm. So that gives them hope. Practically, what it means is give space, depending on whatever prearranged plan you had. So give space for people to calm down, stay around. So we don't just abandon them, because then they feel in threat as well. So we might say something, oh, I see we're in the red zone. I'll give you some space. I'm here if you need me. We reduce the sensory overload. So if there's too much noise, we turn off things that make noise. If there's too many people, we clear the room. If the light is a trigger, we turn off the light. So we have to be mindful of sensory issues. And if there's still aggression and violence in the red zone, then we access other supports. And self-regulation theory also helps us understand that in medicine, we learn primum non nocere, first do no harm. So don't make things worse. So when I do this work with families, then they realize, light bulbs come on, and they realize, so I guess if we yell at our child when they're in the red zone, that probably doesn't help. And we realize probably if we threaten them with more consequences, like they're going to be grounded or not be able to use their devices ever again. When a person's in a fight or flight primitive brain mode there, they just interpret that as threat, and it escalates. Now, it doesn't mean we don't give consequences. We just don't want to give them in the red zone. Okay, so that is the red zone, and that all comes from our life as hunter-gatherers. This is the quintessential fight, the flight. And I'm going to move on. I have some slides here that talk about shutdown zone. And this is relevant if you're seeing kids who have PTSD or dissociative identity disorders, or working with people at burnout. But in the spirit of, in the interest of time, I'm going to bypass this one. But you'll get copies of the slides. So if you want more about that one, it's there for you. So we've talked about the theory. And let's talk a bit more about how do we assess self-regulation. So if you're a healthcare provider and they're coming to see you, then they most likely do have self-regulation issues. And in my training, I learned how to do a classic mental health assessment. What brings you here? What would you like to get out of coming here? And then we ask about their presenting concerns, and we do a psychiatric symptom review of going through different things. And these don't directly ask about self-regulation, but it gives you clues throughout. So what's really cool is if you're doing your heads ed, let's say, and you're asking about what interests and activities you have, well then that tells you about their green zone. And if you ask about goals, what would you like to get from coming here? And maybe they'll say, I don't want to see you anymore. And then you'll say, well, what would you like when you're not seeing me anymore and you're moved on in your life? And then if they give you stuff like, I'd like to get a job, part-time job, I want to move out, get dogs, live in the countryside, that is awesome, because that gives us a sense of some of their goals and things which regulate them back to the green zone. And a classic thing we often see in our work is kids with ADHD. They're moving around all the time. Parents are telling them to sit still. I gently reassure parents, it's okay. I actually need to see your child as they are. And if they need to move, I need to see that. And so that is a clue about self-regulation. So if they need to move around a lot, then maybe they're bored and need more movement stimulation. Or maybe they're just anxious and stressed and they're needing that to self-regulate and calm down. So one of the great things about understanding self-regulation is, first of all, we don't want to block their self-regulation strategy, as long as no one's getting hurt. We just accept it and use that information. So there was an earlier slide, but this slide just is more generic. This is just to highlight the point that when we see kids with mental health issues, think regulation issues that are underneath it. Okay, so imagine we're seeing someone in our clinic. They present with a mental health issue. We've done our history. We suspect they have self-regulation issues, and imagine that you've referred them somewhere for help, and while they're waiting several months to see a mental health professional, they come back to see you. So this is why it's still very helpful to know self-regulation. And what's really cool is when you listen to self-regulation stuff. So if you're listening for the green zones and listening for the red zone, that actually can tell you about diagnoses. So if they tell you getting into green zone is staying at home and never going out, and yellow red zone is I get panicked when people yell and men wear a certain cologne, that makes me wonder if they've had some trauma and triggered by certain things. If someone is referred to us for depression and they tell you when I'm in a happy zone, I'm great, and what gets me to green is not eating food, and when they tell you the trigger is for my yellow zones is seeing girls skinnier than me, and when they tell you their coping strategies to not eat because otherwise no one will love them, well, then that helps us understand that maybe they have an eating disorder. And so you can use this strategy for so many things. It's awesome. There's another one. ASD comes up a lot in my work as well. So if they tell you, if they tell you that what gets him to green zone is we just leave him alone and let him do his thing, like play with a calculator for hours. And then if the family tells you he gets triggered by sounds, he gets triggered by any change or transitions, then that makes us wonder about query ASD. I do actually have to share a really sad one. This is one I saw a few months ago. It was a kid, and what gets you to your green zone? It was camping outside so your stuff doesn't get stolen, having a street family, and selling my safe supply so I don't have to sleep with someone. So that's a very sad one. And special shout out to our friends with the Vanier Pediatric Hub for helping us work on these issues. Okay, so that one is poverty and intergenerational injustice. So let's move on to talk a bit more about treatment. And I realize it's 9:15, so I'll try and wrap up quickly. So first of all, start with basics. Make sure that we review any basic needs and ensure those are met. And as a advocacy thing, there is understanding that perhaps generational inequity in our social policies contributes to this. So please check out our friends Generation Squeeze at UBC. And so imagine we're seeing this family and they're struggling and you've referred them off, but they're coming back. So what are some more specific self-regulation things that you might do? And so in the work I do, we do this thing called the self-regulation map. It's where we actually map out what do they look like in each zone, what gets them into each zone, and what can we do when they're in each zone. So many of you have already done this already. Anyone do it in online dating? So if you have ever done online dating, every dating profile is essentially someone's green zone. So when they say, I love walks on the beach, watching foreign films, going to having dogs, that's their green zone. And then, of course, when you get married to someone, then you find out the reality. And the reality is you learn about what actually triggers them. And so finding out that your spouse doesn't like the seat being left up on the toilet, finding out your spouse needs to have the temperature turned down so it's freezing cold all the time. These are the things you discover in the course of a relationship. And I noticed there's quite a few trainees here today, so I wanted to just do a little thing for you guys. So you want to be successful, find out what gets your boss in their happy place and do it. And conversely, find out what makes your supervisor unhappy and don't do those things. So it's too bad we don't have any surgeons here. Actually, it's probably good we don't have any surgeons here. So if there are any students interested in surgery, definitely figure out what the surgeon's like. And I had a student, a surgical keener the other week, and she told me, oh yes, Dr. Cheng, we all know this already. You don't have to tell us. She says, what triggers them is if I hold the scissors the wrong way, if I cut the sutures too short. So there you go. Okay, self-regulation mapping. So in the work I do, we start off on a positive note always, and we actually go through filling out with the family in front of us. What gets you to your happy place? Or actually, what do you look like when you're a happy place? And so that's when they're happy, want to spend time with people. And then we talk about what gets you to that happy place. And often it's seeing friends, spending time with family, getting enough sleep. Wonderful. And if you're in the happy place already, what other things can we do that can help? And so this is when they'll say, well, if I'm in a good place, this is when I'm open to doing yoga, or this is when I'm open to, in an eating disorders context, it would be trying new foods or doing other things. And this is when we can ask, well, what can parents and adults and teachers and us adults do to support you with this? And they might say things like, spend time with me every day and don't ask me, you have homework to do when I just get home and I'm upset. So earlier we talked about all sorts of generic things like just making sure kids get enough sleep, appetite, nutrition, have good connection, basic needs, higher needs. But this is the map where you can actually then figure out the more specific things. So that's self-regulation mapping. And if bored zone is an issue, then once again, we can figure out in this kid's case, what gets them bored, what can we do about it? And then self-regulation mapping for yellow zone. So if they're presenting with anxiety or stress or anger or OCD symptoms or hearing voices or eating disorder, I just call that the yellow zone for them, because most likely when they're overwhelmed in the yellow zone, that's when those symptoms are worse. So then we can help them come up with coping strategies for all those things. So if their trigger is too much noise, then we can let a parent know. If the trigger is not understanding homework, then we can, okay, so I didn't have this in, but if a trigger is not understanding the homework, then what helps is talking to the teacher or getting a tutor or whatever intervention is. So the other point I'm hoping I'm impressing upon you by doing this self-regulation map is that you can actually break down specific stressors and specifically target and problem solve interventions for each of these zones. And if I didn't say this earlier, we don't do this when they're upset. This has to be done when they're calm. Okay, so that was going through a self-regulation map for understanding people's green zones and yellow zones. And we do the same thing for red zone. So those of us who work in emerge or with a very acute population, red zone mapping is essentially what we call a crisis plan. And so in a crisis plan, maybe people are angry and aggressive. So we want to figure out the triggers and then have strategies for each trigger. And the key about red zone compared to the other zones is when they're in the zone, just give them space and keep them safe and let the storm pass. Okay, so to summarize, if you're in the green zone, we can reason. If you're in the yellow zone, we can relate to them and do empathy and validation. And if they're in the red zone, we want to help them regulate by giving them a sensory calming environment and time and space. In my work, if we come up with that, then we can write it down. I believe in the power of habits. So once we figure out which habits are helpful for them, we write them down. So whatever things are self-regulation, regulating for them, embed them in the routine. And I said I would talk about where to refer. So for those of you who just want to know where to refer, this informs therapy. And so if someone is struggling with bored zones, well, maybe they need more activities, more routines, more chores, responsibilities, volunteering work. Maybe they need more challenge at school or elsewhere. If someone is in the green zone, then that's when we can do talking therapies, like, insight-oriented psychotherapy, cognitive behavioral therapy, or whatever problem-solving, talking, rational interventions you want to use. If, however, they cannot be rational and talk about things, and these are the kids I see where they say, well, we tried talking therapy and, nothing worked. The CBT didn't work. It's not that CBT is bad. It's just that you can't access it if you're emotional in the yellow zone all the time. So that's when you might want to use more emotional focused therapies, or I didn't put DBT down, but DBT goes here too. Interpersonal psychotherapies, attachment therapy, family therapy, things which help improve that. And you can still use anything below. And if they're in the red zone, then even talking about emotions is too much. So that's when we have trauma therapies like EMDR or brain spotting. That's when we can use non-talking therapies like music therapy. Kudos to Landon Coleman, our music therapist at CHEO. We can use animal-assisted therapy. Shout out to Michael Shaheen, our St. John Ambulance pet therapist. That's when we can use art therapy and dance therapy and somatic interventions, energy psychology, butterfly tapping, whatever it is. And so the point of that slide is there's many therapies, and self-regulation helps me understand which ones might work for someone. If people are quote unquote resistant, if people are quote unquote not motivated, it's probably that we're just not matching the therapy for their brain at that time. Okay, so let's wrap up and take questions. So actually, I'll just say, if you want to try this on your own, I have links here in the slides to self-regulation map templates. And now we're going to wrap up. Thank you very much, everyone.
All right, thank you, Michael. I'd like to open it up for questions, and just put your hand up on Zoom or turn on your camera and put the hand up in person. I'll start off with a question, Michael. As you were going through this, I was wondering how this changes or not for kids with significant comorbidities, and I'm thinking especially physical comorbidities or underlying ongoing diagnoses needing ongoing care. So in that cohort of kids who have underlying diagnoses, how does this change or not? And then similarly, I was wondering about kids with developmental disabilities, or especially if they involve cognitive or intellectual disabilities, how this may or may not be.
Yes, I would completely agree that self-regulation framework helps us think about all the holistic things to help a child, no matter what the diagnoses are. So if they have physical stuff, so I'll just use, let's say they have orthostatic intolerance. Well, we can make sure we do physical things to help them regulate their orthostatic intolerance. And that helps us remember to keep that in the plan, right? Don't keep them upright for too long for therapy sessions. Give them bean bags so they can lie down on. And definitely for the neurodevelopmental population, our friends in that area definitely understand that some kids are operating at a red zone level. They're not able to regulate their emotions, their sensory function. They're not able to regulate motor function. And that's why it's nice that our neurodevelopmental teams will, generally have, well, I should say that there's always a shortage of occupational therapy, but there's knowledge of these things, I'll say. And so in our neurodevelopmental teams, there's more knowledge and understanding about how, sensory motor things need to be taken into account in the environment in order to self-regulate. And it's interesting, it's good that globally we have more of an understanding of this, and this does help us understand as we design the new building, the One Door for Care, there are definitely more self-regulation elements built into the nature type designs or the sensory friendly designs that we have now. I'm not sure. Does that answer your question, Pranish, or address it sort of?
Yeah, I think what you're saying is that the overall framework doesn't change, but how you apply it might change or might need to be adapted.
Yes. What I really like about this framework is it's not a specific therapy. It plays well with whatever your approach is. So if your approach is genetic counseling for a family, well, you don't think of it this way, Pranish, but when you do genetic counseling, you actually help reassure them. You help the families, go from that yellow anxious phase to more green phase because now they can understand things. And if the family's calmer and more relaxed, you actually then help them support the kid better. So I wanted to thank you, Pranish, for all the self-regulation work that you do in working with the system.
Yeah, thanks, Michael. I mean, the kind of thing I was also thinking of, I'm reflecting back on a patient I knew with maple syrup urine disease, and most of it was kind of childhood and into adulthood until he had a liver transplant. And in that disease, when you're decompensated, even mildly decompensated over a long period of time, it's like being drunk. So that's the, acute intoxication type, effect that you see. And, there sometimes he expressed to me that he felt in his green zone when he felt slightly drunk because he was slightly out of control, and that was actually not good for him physically. And so it was a real challenge to get him to a different green zone, if I'm using the terminology in the framework. Where he didn't feel as good, right? And it wasn't his happy place, but we needed to get there, otherwise he, would suffer long-term, sequelae. So, it was that kind of interplay with physical disease and, intervention for those diseases. But I totally see how the framework can inform your approach to that. And I guess, my question is really, do you change your approach or inform your care with this approach in mind? So anyway, I won't belabor my question, but yeah.
You know what? That is awesome, Pranish. And then I'm thinking ahead. I'm always trying to think, how can I reduce my cognitive load? And so I'm thinking, for you, Pranish, wouldn't it be great if part of the standard workflow for your clinic is that someone assesses their self-regulation map? By the time they get to the clinician, then the clinician already has a bit to work with to understand what gets that kid to green. So that's my comment. I'm going to say, I know you probably have to wrap up pretty soon. I also have to go off to a meeting with Noah. Otherwise, Noah will get into his yellow or red zone. I'll be zooming into that meeting. But you guys know where to find me. If anyone has questions about what we've done, feel free to just call me, email me. I am passionate about self-regulation and really happy to do this work, answer any questions you have.
Great, thanks, Michael. And there was a comment in the chat if you could share the link to the map. So maybe if you could send that to Rachel or to me, and we can send it around to attendees. Okay, thank you, Michael, and thanks again for presenting today. And Pierre Marc for your contributions as well.
Yes, our Canadian Forces needs more people. And so those of you who are early stage in your training, think about the Canadian Forces. There you go, Pierre Marc. I've done my part for today.
And on that note, we'll close off grand rounds for this week. Thanks again.
Thanks, Nancy.